Hi guys, welcome to another Therapy Talks with Antonia. So this week our topic is autism. So autism spectrum disorder, ASD, refers to a broad range of conditions characterized by social skills, repetitive behaviors, and communication problems with nonverbal as well as speech. There isn't one type of autism, but rather many subtypes. It exists on a spectrum. So people can be distinctively known for specific strengths as well as challenges. So some people with ASD require everyday support throughout their daily routine for everyday functioning. Autism is influenced by a combination of environmental as well as genetic factors that produce the spectrum disorder distinctively within each of the individuals. So it's very different. One person with autism can be very different and unique set of qualities to another person with autism. So indicators of autism can be noticed by about age 2 or 3 in a person. However, sometimes developmental delays can appear earlier, and early diagnosis can occur by about 18 months in a baby. Early diagnosis leads to better and more positive outcomes later on in life for the person, because as early as you can diagnose, you can start learning to function and cope with the autism spectrum disorder that the child has and how they can more or less adapt to the spectrum disorder. So factors that influence autism include sensory sensitivities, medical conditions such as sleep disorders, gastrointestinal issues, as well as seizures. Others also include mental health problems like anxiety and depression. All these play a hand in influencing autism and its development. So people with ASD have a lot of factors that influence their functioning. So one of these symptoms include communication problems. So some of the examples of these symptoms can be little or no eye contact maintained between the person with autism and another person. They also fail to show that they're attending to and listening to a person when they're speaking. They also have a failure to show enjoyment of objects. They don't seem to enjoy activities and they don't show it to other people through these activities and objects. They also get very entertained by their own topics that they enjoy. So they get overwhelmed into a conversation about something that they readily enjoy, and they get carried away into that conversation, extended for greater periods of time past interests. They also have facial expressions and gestures that don't match what they're discussing, and they have difficulty understanding another person's point of view. So people with ASD also have restrictive or repetitive behaviors. Some of these include having a lasting and long, intense interest in certain things such as numbers and details. They also repeat certain behaviors or have unusual repetitions in terms of repeating certain words or phrases. They have overly focused interest in moving objects or parts of objects that they pay great attention to. They get upset by slight changes in routines where they expect a certain type of normalcy to be happening, and you change your routine, they get upset by that change without them having knowledge to prepare for that change. They are more sensitive than other people to sensory inputs such as light, noise, clothing, and temperature. So they are more affected by a sudden change in light or a loud noise versus how regular people would respond to that sudden change. So some of the strengths of persons with ASD include they're very good visual and audio learners. They excel in math, science, music, and art, and they have great attention to detail, and they can remember things for a longer period of time than most of us can. So some of the risk factors to having a child with ASD include older parents, having a sibling that also has ASD, having a low birth rate, as well as genetic conditions such as Down syndrome. So that's it for this week's topic on autism spectrum disorder. Thank you for viewing. We look forward to hearing from you any feedback or suggestions on following topics. Have a blessed day and take care. Thank you. Bye-bye. 3, 2, 1. Hi. So some of the strengths of persons with auditory. Changing the whole topic. Medical disorders like gastrointestinal. Corella's not entertaining us.